Welcome to UMCC Medical Consultant Connector, where your health matters to us. Hey there folks, welcome to the most unexpected party crash of your life. Tonight we're diving into the wild and somewhat terrifying world of leukemia. Now I know what you're thinking, leukemia? On a Friday night? John, you're killing me. But hold on, there's more to this story. But trust me, this is one party you don't want to miss. Or well, you definitely don't want to be the guest of honor at this party. Imagine your bloodstream as a vibrant party, and then, out of nowhere, this uninvited guest shows up. This guest is not just crashing the party, it's turning everything upside down. It's more like a party your blood cells are throwing and they're being total jerks about it. We're talking fatigue, bruising, infections, the whole shebang. Your blood cells are in chaos and it's not a pretty sight. But fear not, dear viewers, because tonight we're arming you with the knowledge to spot this unwelcome guest and show it the door. We'll guide you through the symptoms, the signs, and what to look out for. Knowledge is power, and we're here to empower you. So buckle up, grab a beverage, non-alcoholic, we're talking about your health here, and let's get this leukemia party started by shutting it down completely. Together we can make sure this uninvited guest never crashes your bloodstream party again. Alright folks, let's break it down. Leukemia, in the simplest terms, is like that one friend who just won't stop making copies of themselves, you know the type. Except instead of awkward conversations and questionable dance moves, we're talking about white blood cells. These normally heroic cells tasked with fighting off infections decide to go rogue. They start multiplying like crazy, crowding out all the other important cells in your bone marrow. It's like a bad house party, but instead of a hangover you get, well, leukemia. Not ideal. Now why does this cellular chaos happen? Good question. It's a bit like trying to solve a puzzle with missing pieces. The truth is, leukemia's causes are still a bit of a mystery. Scientists are working tirelessly to uncover the hidden factors. It's like trying to figure out why that one friend always wears socks with sandals. We just don't have all the answers. The complexity is mind-boggling. We do know that genetics play a role. Kind of like how your family might be predisposed to embarrassing dance moves at weddings, certain genetic mutations can increase the risk. Then there are things like radiation exposure and certain chemicals which are about as welcome as a skunk at a picnic. These environmental factors can also contribute. But remember, just because you have a family history or have been exposed to these risk factors, doesn't mean you'll get leukemia. It's not a guaranteed outcome. It's complicated. Just like that friend who insists on karaoke night. The interplay of genetics and environment makes it a tough nut to crack. Section 4, Signs and Symptoms. When your body throws you a bone marrow of contention. So, how do you know if leukemia is crashing your blood cell party? Well, your body will usually start sending out some pretty clear SOS signals. You might feel constantly tired, like you just ran a marathon, even if your most strenuous activity was switching between streaming services. You might bruise easily, even from a gentle high five. And those pesky infections? They'll feel like they're coming to a stay a while and ruin your week party. These symptoms can be caused by other things too, but it's always best to get checked out by a doctor, just in case. Section 5. Investigating leukemia, playing detective with your blood. Now let's say you go to the doctor feeling like you lost a fight with a bag of potatoes. The doctor, being the brilliant medical detective they are, will probably want to take a peek at your blood. This is where things get really interesting, or, as interesting as staring at a vial of your own blood can be. They'll look for those rogue white blood cells, see if you're low on other important cells, and maybe even do a bone marrow biopsy. It sounds scarier than it is, I promise. Think of it as a tiny peek behind the curtain of your blood cell factory. Section 6. Prevention and treatment kicking leukemia to the curb, with a little help from science. Okay, so we've talked about the causes, the symptoms, the investigations. Now for the big question, how do we get rid of this unwelcome party guest? Well, I'm not going to lie, folks. Treating leukemia is no walk in the park. It's more like a marathon, uphill, in the snow, while carrying a backpack full of textbooks. Imagine the weight and the struggle, but also the determination and the will to keep moving forward. But here's the good news. We've got some pretty amazing tools in our arsenal. Science has come a long way, and we have more options than ever before. Chemotherapy, bone marrow transplants, targeted therapies. These are just some of the weapons we use to fight back. Each treatment is tailored to the patient's specific needs, making the fight more effective. And while the journey can be tough, remember that you're not alone. Support is crucial, and it's always there. There are doctors, nurses, researchers, and a whole support system ready to cheer you on every step of the way. They are dedicated to your well-being and recovery. So let's raise a glass of juice, remember health, to kicking leukemia's butt and getting back to the parties we actually want to attend. Here's to health, resilience, and the power of science. EMCC, your ultimate medical consultant connector. Kindly like, subscribe, and share.